ladies and gentlemen. Today we are going to tell you about a woman from Argentina appears to have rid herself of HIV without drugs or treatment. The second documented case of its kind in the world. Doctors believe the patient's immune system cleared the virus on its own. Tests on more than 1 billion of her cells found no viable trace of infection. Archives of internal medicine reports. If this process could be harnessed, it might offer a way to wipe out or effectively cure HIV, experts say. Eliminating HIV, the findings are further proof of few people are born with natural resilience to HIV. Some have genes that prevent infection. Others, including the Esperanza patient who wishes to remain anonymous, appear to catch but then eradicate the virus. But most people with HIV need lifelong antiretroviral therapy. And if they stop taking these drugs, the dormant virus can reawaken and cause problems again. In recent years, however, there have been reports of elite controllers who can suppress the virus with help out no HIV medication. Adam Castillo from London was able to stop taking his daily HIV pills after receiving a donor stem cell treatment for a cancer he also had. London patient cured of HIV, say doctors. His HIV-infected cells were wiped out and replaced during the cancer therapy, and fortuitously, his donor was one of the 1% of people born with genes that prevent HIV entering and infecting cells. It is unclear how long this advantage might last for Mr. Castillo, however, sterilizing cure. But the Esperanza patient has had no detectable HIV for more than 8 years. Lorraine Willenberg from San Francisco also appears to be functionally cured of HIV by her own immune system, and this offers hope of a sterilizing cure for other patients. Lead investigator Dr. Zhu Yu from the Reagan Institute of Massachusetts General Hospital, Massachusetts Institute of Technology and Howard said there may be an actionable path to a sterilizing cure for people who are not able to do this on their own. We are now looking forward to the possibility of inducing this kind of immunity in persons on Earth through vaccination with the goal of educating their immune systems to be able to control the virus without art. Abortive infection. Professor John Frater from the University of Oxford told News while it was almost impossible to say if someone had been truly cured of HIV, the investigators had done as much as could be asked of them with current technology to prove it. The key question is whether this patient was actually cured themselves or alternatively had some form of abortive infection which tried to get going but the embers were snuffed out early, he said. Her immune system clearly shows a memory of having been infected, so there seems to be no question that she was. Regardless, there may be similar patients out there offering much to learn in the search for HIV care. Professor Sarah Fittler, an expert in HIV medicine at Imperial College London, said the work would help inform immune therapies currently under development, but Dr. Andrew Friedman from Cardiff University Medical School said current HIV drugs were extremely effective, and while looking at future treatments was important, improving access to life-changing art around the globe was an urgent priority. So if you are looking forward towards more interesting news, don't forget to subscribe and